Okay, so the gait belt goes at the narrow part of her waist. Wow, this hasn't been used, I think. Okay. Okay, so you want to make sure it's snug against their body, not too tight, not too loose. So it's just at the narrow part of her waist above her pelvis. When you guard with a gait belt, you're always going to use a supinated hand, and this is even too loose for her. See, I have no muscle. I don't use my muscles with patients. Okay, so you're always going to use a supinated hand, like this. Same thing, staggered stance. And I keep the other arm over here, in front of her shoulder, like that. If she falls to the side, also your left, I can pull her back, bringing her center of mass over her base of support. Same concept as we did previously. You're just using a supinated hand. What I don't like about it is that for the person who buckles, you have to pull up. Like, you can get your leg under her, but you're going to be pulling up on the gait belt. It's uncomfortable for the patient, and it's hard for me to use my bicep. So just something to keep in mind. When you guys practice this, you'll feel the difference between using a gait belt versus not using one. I just think that going like this is much easier on you and the patient. It's safer, rather than pulling them up with a gait belt, or like if you were pulling them up with their pants, you're literally just giving them a wedgie.
Your hands on the gait belt while you're doing this?
It's like a leash. Literally. It's a leash. That's it. I just have a supinated grip.
Why can't you hold it at the hip almost similar to the other position? That way you don't have to pull so much.
Like this?
And then if they go
Same thing. Yeah, I'm catching her with my leg anyway, but I still feel myself using my biceps. Also, with the gait belt placement, you use this position typically, smallest part of the waist above the pelvis, but if the person has like a feeding tube or a lumbar surgery, that kind of thing, you want to place the gait belt above the surgical site. If you put it below and they fell, you're going to interfere with whatever went on there, and you don't want to mess with that. Okay? So